Hey everybody, this is Dr. Delaney again, and today's story is from a day in the life of a regular outpatient pediatrician, and it does contrast with residency. However, when we're in residency, at least back in my day, we had many admissions that were for routine chemo administration for children with leukemia. There are many different kinds of leukemia. For certain ones, like B-cell ALL, acute lymphocytic leukemia, the outcomes can be pretty decent, greater than 90% survival. But don't let that statistic make you think that it's an easy path or that it's automatic or that it's guaranteed. It is a nightmare for these families. And many parents worry about leukemia, even if there are just very minor symptoms. And typically the symptoms are not minor, they're pretty major. So let me tell you about this case. I can, spoiler alert, tell you that this one did have a happy ending. Not all of the ones I have seen did. One of the saddest ones was a child I saw as an outpatient appointment with the child's grandparent because there was a lot of family issues and the mother had abandoned the family, and she came in only because the grandmother was a little perturbed with her that she was lazy in school and kept putting her head down on the desk. And when I walked into the room, she was yellow from head to toe, exhausted, could barely keep her eyes open. And as soon as we did a CBC or a complete blood count, we knew why. And in that case, that did end poorly. She had a ML, and that does not have as good of a survival rate. It can, and they still have certainly protocols, we call them POG, Pediatric Oncology Group plans, depending on the biopsy and the specific type of leukemia that the child has. Now, the story for today, I was in a regular outpatient clinic. Thank goodness we had a CBC machine, complete blood count machine, absolutely required for outpatient peds. I've had to fight for that in various situations and various groups through the years. But in this case, we had an excellent lab at this particular practice, and the mom had called to make the appointment because the child appeared jaundiced to her. Now, this mom, if I am recalling correctly, had worked in a lab herself, and so had certainly some medical knowledge. I suspect that she was afraid it was something really bad, but hated for it to be, understandably, and so knew she needed to come in, but dreaded to come in, if that makes sense. And so always in a pediatric situation, we're pressed for time, I feel like, because there are so many kids who need to be seen each given day, and so we're hurrying, and I rushed into this room and realized this one was not going to be a fast one. And when I first saw the child, beautiful, funny, but she did look tired. And despite being a brown kid, not very dark, but medium brown, I could still tell she looked jaundiced. And that can be tricky. It's very important in medical education for students to learn what rashes and various things look like on different skin tones, because it does look different if the patient's very, very, very pale, if the patient's light brown, medium brown, dark brown, brown, black, it looks different on their skin. So it's important for us as professors in medical education to have slides of rashes with different skin tones, and for students to pay attention and to learn how to find those different clues on different skin colors. So when I went in, the mom shared with me the history. Well, that day, the patient was there with the mom and the dad. The dad seemed very stoic, very quiet. The mom did most of the talking. So I suspect maybe the dad wasn't in medicine, but the mom, did have a medical background. And she explained that this child had had easy bruising and bleeding. The child was extraordinarily fatigued. And now the whites of her eyes, the sclera, looked yellow, or what we say ecteric. And then they noticed that her body began to look yellow. Well, you guys, all these symptoms, as I'm hearing them, my stomach just starts to hurt more and more and more, because I'm thinking, oh, wow, they just keep checking the box for all the things that we're afraid of for something really bad. And then she got up on the exam table by herself, and very cooperative, sweet child. And I did her exam, and I had her lie down on her back, because I wanted to feel if her liver and spleen were enlarged. And you don't appreciate how many times on a physical exam you write or type no splenomegaly, no hepatomegaly, meaning no enlargement of the spleen or liver. We can't feel them underneath the costal margin. That means the very bottom rib. And we really shouldn't feel them. In this case, I went to palpate her liver and spleen, and they were so distended, they were so full, they were so just huge. that they went all the way down to her right front hip bone, that iliac crest. So her entire abdomen basically was filled with liver and spleen. And it just made me so sick. I remember looking around the room, making sure I knew where the trash can was in case I threw up. I mean, it physically made me feel sick. It was, in my mind, absolutely leukemia. So the next step, and now this is very delicate because I can't say it's leukemia. I don't have a bone marrow biopsy yet with a pathology diagnosis of all that. I can't say that. I just know it's bad. And so I told my nurse we needed a CBC, and I told the patient she could go to the prize box once she got her finger pricked. And we did the CBC, and it was, as it always is in these cases, horrifying. The white blood cell count was through the roof, probably leukemic cells. The hemoglobin, which should be 12, was 4. And the platelet count was maybe 6. It should be greater than 150. So the reason she's bleeding and bruising easily is because she has no platelets to speak of. The reason she's exhausted is because her hemoglobin is horrendously low. And somehow with a hemoglobin of 4, that child managed to walk to the prize box because she was so proud of herself for being brave with her finger prick. Now, once I got those CBC results back, I really wanted to throw up, but I didn't because I knew it was horrible. So I paged the oncologist on call at a local university medical center, ran the story by them, and they said, send the child by family car to the emergency department, and they would get everything started. Now, in kids with leukemia, things work much faster than they do with any kind of adult cancers, I think. And I get frustrated with adult medicine when I hear family members moving slowly because we diagnose it. They're in a family car, stat within an hour. They are getting a bone marrow biopsy. They are under anesthesia for central line placement to receive their chemotherapy. They are getting assigned to a pediatric oncology group to map out the plan for treatment of this. Like, it moves fast, and it needs to, because they can also die fast, kids can, with leukemia if unrecognized and untreated. But like I said, it's not subtle, so don't panic if you're watching this. And when I went back in the room to let the family know of the CBC results, that oncologist that I spoke with on the phone was so kind, because she even told me, Lori, you don't have to tell them it's leukemia. You can tell them you're concerned it is, but until we have the bone marrow biopsy with the pathological official diagnosis, from the pathologist, you can't say for sure. So you can just let them know that's your concern. The diagnosis will come later with her evaluation. And that was so very kind of her, I thought, looking back on it, for the oncologist to sort of give me an out, to give me the ability to say, I do have bad news, but I don't know exactly which kind. That will come with the next level of evaluation. So I went back in the room, and I told you the dad had been very just sort of quiet, taking it all in, listening to his wife give the history, watching his daughter. You could tell he was a very loving dad. And when I went back in the room, he still didn't say a word, but tears were just streaming down his face, both sides. So I know they knew. I know that they could have seen it on my face when I did her abdominal exam, and it just was so horrible. And this was years ago, so it was before we were wearing masks all the time, which I sometimes appreciate the mask because maybe it can help hide my also expressive face, even when I don't mean for it to be expressive. So I'm sure my face looked horrible when I did her abdominal exam, and they could probably see the sadness. And you know me, I'm one of those, certain kids, if they see somebody vomiting, they vomit too, and I'm that way with crying. So if a parent's going to start crying, I'm happy to join them, which of course I did. But I was trying to tell them, there are experts at this university medical center. It's going to be okay. They're going to take great care of you. They're going to know exactly what's going on. And praise report, she is doing well these days. She got through all those horrible days of getting the central line placed and getting the chemo and the side effects and the recurring admissions to the hospital. And but she had a wonderful family who loved her and took great care of her, which is so, so valuable in these situations. So leukemia is terrifying. It's one of the things that we dread as an outpatient physician. A slightly good news I could say is when you're in residency, you just feel like every other kid has leukemia because you're readmitting them for, their chemo cycles and everything. But in real life, in outpatient peds, it's very few and far between. Thank goodness. Those are the two cases that come to mind. I have had others, but those are probably my two most memorable ones. and some of the other really sad hard diagnoses can be new onset type 1 diabetes. We'll talk about that at another time, but I just wanted to share that story of leukemia with you guys, and that one child with awesome family is doing well now. Thank goodness.